It's Friday evening, the 16th of July, and you are very welcome to this talk. Now, I've had lots of questions about immune escape, people getting infected after the vaccines. How likely is it people are going to get infected after they've been vaccinated, especially if they've been doubly vaccinated? And how likely is it they're going to get sick? And also, how likely is it they're going to transmit the virus on? In fact, also, I've had quite a few questions about long COVID. Is vaccination going to protect us against long COVID? And the data so far is showing that vaccines, especially if people have been doubly vaccinated, do have a high degree of protection against long COVID. We don't know quite how much yet in number terms. That data should be coming out pretty soon, but it's expected there's going to be quite a high level of protection against long COVID. So protection against long COVID, good reason to get vaccinated. But let's go back to how likely it is that vaccination will prevent you getting seriously ill, which is the main important factor, really. And I think to do this, we'll go through a study from Israel, because Israel led the way, of course, with the Pfizer vaccinations. And there's a study just published in the last, it's about a week ago now, actually, but it's exactly on this topic. So COVID-19 risk factors linked to post-vaccination breakthrough infections. So a breakthrough infection is when someone still gets the infection, even although they've had the vaccination. Breakthrough infections. This can still get infected. So the vaccines are not 100%, of course, as we know. Now, I think just before I go on to the Israeli data, actually, I'll play you a clip from the Prime Minister's press briefing last week, where there's question about the likelihood of getting infected after vaccination, and the likelihood of passing the infection on after you've been vaccinated is dealt with by our Chief Scientific Officer, Sir Patrick Vallance. So let's just look at that now. It only lasts for a minute or two, but it's quite interesting, useful context.
We know that 2 doses of the vaccine are very effective at reducing severe cases of COVID-19. But what is the evidence that the vaccine also prevents you from unknowingly passing the virus on? And how does the vaccine remove the need for self-isolation? Does having 2 doses of the vaccine mean you're less likely to infect others?
Sarah, very good question. I have a figure in my head of reduction of transmission of about 67% or something like that. But Chris or Patrick, do you want to comment on that?
And then Chris may want to come in on this. I mean, we haven't got absolute figures for Delta, so it's important to recognise that there's uncertainty around the numbers on this. But if you took our figures for Alpha, and if you took a sort of general approach to this from the data we've got, roughly speaking, the vaccinations are decreasing the chance of somebody vaccinated from catching the virus by, let's say, 50% or so, maybe a little higher after double vaccination, depending. Roughly, it looks like they're decreasing the risk of transmission, if you have caught the virus, to somebody else by about 50%. So overall, that means as a vaccinated person, you're something like 75% less likely to be able to infect somebody else in any situation, because you're less likely to catch it and you're less likely to pass it on. And those figures will change as we get more data. But Chris, you may want to add.
No, I completely agree with those numbers. And I think just the thing to point out is that, of course, that means that roughly a quarter of people can still pass it on. And therefore, it's not someone being vaccinated substantially reduces the risk to people around them, but does not eliminate that risk, which is the reason why isolation is still important if someone has COVID or has a high chance of having COVID.
And just to be clear, those figures are about likelihood of contracting the virus. As Chris said earlier on, the protection of vaccines against severe disease, hospitalizations and deaths are very much higher, and indeed after 2 vaccination doses are right up in the sort of 90+%.
Thank you. Hugh Pym.
Okay, so there you go, straight from the scientific officer, and the chief medical officer agrees completely. So in other words, we see that if someone is vaccinated, it's going to protect them against infection by about 50%. Now, it's going to protect them against symptomatic infection by more than that. We know that. But because if someone's vaccinated and they do get the infection, if they do get it despite being vaccinated, then the viral load is likely to be lower. Therefore, it's going to be less transmissible. So it's not impossible. So that kind of answers that question. So people that are doubly vaccinated, still about a 25% chance they can pass it on, about 75% reduction in transmission. People that have had vaccines, especially doubly vaccinated people, definitely less likely to get COVID, long COVID, definitely less likely to get long COVID, and we should have some figures on that pretty soon, how much less likely they are to get long COVID. The thing is, if someone's had 2 vaccines and they get this COVID infection, as Sir Patrick Vallance has just said they can, then it's not likely to be the fever, the persistent cough, and the anosmia and the other problems that we had with the original version. It's more likely to be common cold version. So the headache, the runny nose, the sore throat, the sneezing. It's not going into the lungs. It's not causing a severe disease. So it seems that the long COVID is nothing like as likely, partly because of that. Although we do know, irritatingly, that people with relatively mild disease can still get some long COVID. But so given that some people who have had 2 vaccines are still going to get infected, how likely is it that they're going to get sick enough to be hospitalised? And that's what this paper's about. So let's dive into the detail of this. Now, this is from the journal Clinical Microbiology and Infection. Check it out for yourself. Full text is available. So by background, it says a minority of vaccinated individuals might get infected and suffer significant disease. So that is still possible. We know that most are going to get mild disease, but it's still possible. So they want to characterise the vaccine characteristics of vaccine breakthrough infections and who is likely to get these infections, or particularly not so much who's likely to get these infections, but who's likely to get sick as a result of the infections. Because we don't mind having a bit of a cold. We don't even particularly mind a symptomatic infection because it's not going to make me too sick, although I have to be careful not to pass it on to other people. But we don't want to be sick enough to be hospitalised, and we certainly don't want to die. So Israel, population of 9 million, population-wide study, people who were hospitalised with COVID-19 despite full vaccination in Israel. And I've been having lots of emails saying, there's lots and lots of people in Israel being hospitalised after being doubly vaccinated. So this paper gives us the definitive numbers on that, so let's get to that. The method, retrospective multicenter cohort study, 17 hospitals, probably the most of the main hospitals in Israel are included in this. Israel was most of the Pfizer BioNTech vaccine, so it's looking at that patients who were fully vaccinated and who developed COVID and required hospitalization. In other words, they were sick. And the study looked at people more than 7 days after the second dose of the vaccine. But 18% of the admissions were before 21 days after the second dose. So because we know that 21 days is the full amount. So 18% of these people that were admitted, it was after 7 days, but before 21 days. And we know that the infection, the resistance to infection is going to build up. The immunity is going to build up further. So that means that these are going to be overestimates, if anything, because some people were still waiting for the vaccine to take full effect. Now, the proviso, as Patrick Vallance says there, this is not necessarily Delta related. This is from Israel, where at the stage, a lot of it was Alpha. The wild type, the original type, was 7%, and the Beta, first identified in South Africa, 4%. So this was mostly the B117, the UK Kent variant in Israel. But we know the vaccines are not quite as effective against the Delta, but not far off it. Now, straight on to the results. 152 patients were hospitalised. So that sounds quite a lot. Now, this is basically half of the hospitalised fully vaccinated patients in Israel. So in other words, the total number of patients vaccinated who got hospitalised in Israel was 304 for the country. So this study picked up 152 of them. So 304 people who were doubly vaccinated in Israel were hospitalised. And that's out of 5.17 million fully vaccinated people. So 304 people hospitalised out of 5.17 million. Now, without the vaccinations, it could have been 5%, which is 50,000 per million. So that's 250,000. 250,000 people could have been hospitalised. Well, it'd be impossible, wouldn't it, in Israel? So you see the vaccines are reducing this from hundreds of thousands to 304. So 304 hospitalised out of 5.17 million people fully vaccinated. And even then, some of those hadn't waited for the full 3 weeks. Some of those were just after 7 days. So had everyone waited till after, had this data been collected after 3 weeks, that number would be less than 304 out of 5.17 million. So that is a very high degree of protection. Median age of hospitalised patients was 71. So the range was 22 to 98, but that was, most people were around about that age. That's the median range. So we see that the patients hospitalised tended, not always, to be older. So, as I say, they picked up half of the hospitalised fully vaccinated patients in Israel, which is excellent. Now, there was a poor outcome in 38 patients. So of this 304, 38 had a poor outcome, and poor outcome means they were ventilated or they died. The mortality rate in those hospitalised of that 304, actually no, it's not 304 would be the number for the whole country. The number in the study was 152. So 34 out of 152 died. 22% of that number died. So presumably in the whole country, 68 died, presumably for the whole country. But that's just for those that were hospitalised. So 34 of the 152 died. So that's 34 people died out of 5.17 million vaccines, or even if we only take it as half as that, 2.5 million vaccines. If we're just thinking about the 152 patients accounting for half of the population. So I think you'll agree these are actually pretty impressive figures. I didn't actually work out the percentage. 304 related to 5.17 million is not very many. And out of the 152 followed up, 34 died. 152 hospitalised, 34 died. And we've seen that they are mostly in the older age group as well. Although the youngest person actually admitted was a 22-year-old, but there wasn't many of those, thankfully. 71 was the median age. Now, what were the other comorbidities? In other words, who is likely to be hospitalised despite being doubly vaccinated? Well, people that are older is one thing. And they identified these comorbidities. Cohort characterised by high rate of comorbidities. So remember, out of this 152, this is out of 152 patients, 108 had high blood pressure, 71%. Wow. And we know hypertension is a significant risk factor for more severe COVID. And now we're learning that it's a risk factor for more severe COVID after vaccination as well. In fact, all of these risk factors that make people more at risk after vaccination are essentially the same as the risk factors that we knew about a year ago when people, before we had vaccines, for the risk factors for people developing severe COVID after any COVID infection. They're all pretty well the same. And hypertension, we know, is a big risk factor. Diabetes, also a big risk factor. Now, clearly, these percentages add up to more than 100 because quite obviously some people had more than one comorbidity. So diabetes, a big risk factor as well. 48% of those hospitalised had diabetes. Chronic heart failure, chronic heart disease, 27%. Chronic kidney disease, CKD, 24%. And chronic lung disease, also 24%. So again, we see these chronic long-term conditions, hypertension, diabetes, chronic heart failure, chronic kidney disease, chronic lung disease, dementia 19%, cancer 24%. Only 6% of people, that's 9 out of the 152, had no recognised comorbidities, and most of those were older. So the same comorbidities making the likelihood of hospitalisation after vaccination as the comorbidities making hospitalisation more likely without vaccination. And added to that, superimposed a lot of these people as well as having these specific comorbidities, also had what was described as immunocompromise, and that was 40% had immunocompromise. People being immunocompromised are not able to make a good immune response to the vaccine as you and I might, because they've got a problem with their immune system and they are not responding to the vaccine properly. So I thought that was pretty interesting. So if you've had 2 vaccines and you don't have comorbidities, 3 weeks after your second vaccine, your chances of being hospitalised are pretty low. Pretty low. 9 people in this study. So double that to make it 18 for the whole population, and that's after 5.17 million vaccinations. So we see this highly protective effect against hospitalisations of people that have had 2 vaccines. Highly protective. People that had 2 vaccines, higher Higher SARS-CoV-2 viral load was associated with a significant risk for poorer outcomes, and this is true. People that were vaccinated do generally have lower viral loads, but those that still had viral loads, because they were immune compromised and the immune system couldn't fight the virus, so the viral numbers increased, they didn't do as well. And nothing new there. We've known that for a long time. Higher viral load associated with poorer outcomes. So there are conclusions from this study. Severe COVID-19 infection with a high mortality rate might develop in a minority of fully vaccinated people, especially with multiple comorbidities. So quite a few of these had several of these comorbidities, because we see that these numbers add up to way more than 100. So some of them obviously had more than one. Quite a few were immunocompromised as well as the comorbidity. Higher rate of comorbidities and immunosuppression compared to non-vaccinated hospitalized patients. So higher rates of comorbidities and immunocompromise. In other words, it takes more comorbidities to not respond to the vaccine than it does to be hospitalized if you're not vaccinated. In other words, most people with comorbidities were covered by the vaccine, who would have previously been at high risk of hospitalization. The implications: develop guidelines to augment protection in these people if we know there's a risk they're not going to get good immunity or be at risk from hospitalization. That could be continued social distancing, that could be an additional booster dose of vaccine. And in fact, Israel is currently offering a third dose to people with immunocompromise, and presumably to some of these people with significant comorbidities as well that are often associated with immunocompromise. So although that sounds bad, yes, there are people in Israel being admitted after 2 vaccines. It's about just over 300 for 5.17 million people that are fully vaccinated. So a remarkably low proportion, indicating that double vaccination is having a very protective effect against hospitalizations. The ones that are still hospitalized have got very often these chronic long-term comorbidities. The only one I was surprised about there is didn't mention obesity. But of course, obesity goes with hypertension, and it goes with it goes with diabetes very often. It goes with these type 2 diabetes sometimes. It goes with these chronic conditions anyway, but they didn't identify it separately. So that's that. Pretty good news all round, really, for people that are doubly vaccinated. Now, World Health Organization has admitted it's made some errors. Good, encouraging to see there is some self-awareness developing. And this is to do with the report on viral origins, and it's actually pretty interesting. So let's just have a look at this. The WHO has said it will fix several unintended errors. So it's good to know that the errors in their report that the team submitted after their rather expensive trip, we believe, to Wuhan, unintended errors were there, but they're going to fix them. After they were highlighted by external sources, it has to be said. So this is not their own volition. They were doing this after this had been flagged up by some news. Well, the Washington Post was largely responsible for this. And WHO is going to look for other possible discrepancies. So there could be other possible discrepancies. Changing the viral sequences identification associated with 3 of the 13 early patients. Now, of course, the 13 early patients here are critical to where this came from. So they're changing the viral sequence identification. And, of course, the viral sequencing, the genomic sequencing, is vital because this is the phylogenetics of the virus, and this tells us the evolutionary origin of the virus. It's like me doing my family tree. Who are my parents, grandparents and great-grandparents? It's exactly the same thing. It tells you where you came from. WHO said they will clarify the first family cluster was not linked to the Hunan wet market in Wuhan. Right, so let's get that. The first family cluster was not linked to the Hunan wet market in Wuhan. So the WHO are going to clarify that the first family was not linked to the Wuhan food market that people have been blaming, the wet market. First patient fell ill on the 8th of December 2019, according to this report, and that goes back about a week earlier than they had previously said. So that's another date that they're going to have to change. And the first cluster, the first patient, lived on the other side of the Yangtze River in Wuhan district. And the Wuhan district is close to the Xinjiang district. Now, I'm aware some of you won't be well up on the districts of on the districts of Wuhan. So here we are. So we had thought that the first case was here in Hunan, right, in the wet food market. No longer the case. No longer the case. And we noticed that the river's running along here, right? The first case actually turned up in Wuhan. So the report said the first case was in Hunan. It was wrong. That was wrong. They've now agreed that's wrong. They now have agreed the first case was in Wuhan, and they're going to correct that in their report. And of course, Wuhan, coincidentally, is near Jingzhang. That one there, sorry about my pronunciations, I know they're completely wrong, which coincidentally is where the Wuhan Institute of Virology is located, on the same side of the river as Wuhan, where the first cases came from. The first case was not identified in Hunan, where the wet market is. So I'm pleased to see that the WHO is going to be clarifying this report. So that's the Wuhan districts. Now, WHO spokesman says this: the question of where the first known patient lived relative to the river was not relevant to the origin of the virus. So that's reassuring, isn't it? The current first known patient is most probably not the first case. Okay, so they think. Mistakes in the report were due to editing errors. Oh dear, editing errors. Right, okay, fair enough. They did not affect the data analysis process nor the conclusions. Excellent, pleased to hear that. Right, so there you go. There you go. What do people think of this? Well, Lawrence Gostin, Professor of Global Health Law, Georgetown University, said we need more explanation about what the source of the error and the information was. I do hope no one's thinking they did this deliberately to try and get away with it. There's no clarity, and this does feed into public distrust of the integrity and rigour of the Origins investigation, doesn't it? So there you go. World Health Organization made a unintended error. What did they say it was? Editing error. Did they say an editing error, wasn't it? Oh, yeah. Mistake in the report due to editing errors. So they made an editing error, and they've now correcting that. So we look forward to the amended report. There you go. And we are paying these people. So I think that's us for today. Good evidence for double vaccination, certainly. It's not to say there's not risks, but all the regulatory authorities around the world are saying that the vaccines are much safer than the risk of getting the disease. And those hospitalization figures are certainly backing that up pretty strongly. So that's where we are at the moment, and lots more to talk about fairly soon. I'm going to leave it there, actually, but that'll do for today. Thank you very much for watching.